Have you and your loved ones ever experienced sudden weakness or numbness that seem to progress rapidly? Or perhaps you have heard of Guillain Barre syndrome, a rare but serious autoimmune condition affecting the nervous system. In today's video, we will uncover the mysteries of this condition, its causes, symptoms, and conventional treatments. But most importantly, we will explore how the holistic science of homeopathy can support the recovery, improve quality of life, and complement medical care. If you are curious about how gentle and personalized remedies can make a difference in managing Guillain Barre syndrome, stay tuned till the end. Guillain Barre syndrome is a rare autoimmune neurological disorder in which the body's immune system attacks the peripheral nervous system. It can result in muscle weakness, numbness, and in severe cases paralysis also. GBS often follows infections like respiratory or gastrointestinal infections, and in rare cases it can follow vaccination or surgery. Diet itself doesn't directly cause Guillain Barre syndrome, but foodborne infections like Campylobacter jejuni or it is a triggering factor. Avoid high-risk foods like raw or undercooked meat, unpasteurized dairy and contaminated water to reduce the risk of infections that may lead to the GBS. Now we'll see what are the important key symptoms of the GBS. The first one is the initial symptoms or beginning. You will find tingling or weakness in the legs that can spread to the arms and upper body. Next one is a difficulty with walking or climbing the stairs. Next one is a progressive symptoms. Here you will find severe muscle weakness or paralysis. Then there are loss of reflexes, difficulty in breathing. In severe cases may require mechanical ventilation. The third one is a recovery phase. Here you will find symptoms often peak within 2 to 4 weeks followed by gradual recovery. Now we see what are the key investigations for the Guillain Barre syndrome. The first one is a clinical evaluation. Here you will find progressive symmetrical weakness, loss of reflexes, history of recent infection like respiratory or gastrointestinal. Then comes the cerebrospinal fluid CSF analysis. Here you will find elevated proteins. Then comes a nerve conduction test NCS. Here you will find slow conduction velocity, prolonged latencies or conduction block. Then comes the EMG. Then it shows confirms demyelination or axonal damage. Then infection screening. Then comes the pulmonary function test. It assesses the respiratory muscle strength, and the last one is the MRI. It rules out structural lesions, may show nerve root enhancement. Early CSF and NCS findings are key for the diagnosis. Now we see what are the complications of GBS. Here you will find respiratory problems. Weakness in the chest muscles can lead to difficulty in the breathing requiring ventilator support. Then it comes a paralysis, temporary or long-term paralysis, often starting in the legs and progressing upward. Then comes the heart and blood pressure issues, irregular heartbeat or blood pressure fluctuation. Then comes the pain and sensory issues, persistent nerve pain and altered sensation like tingling and burning. Then blood clots and pressure sores due to immobility during the recovery. Next one is a slow recovery. Some individuals may face prolonged weakness or fatigue even after the treatment. Now we'll see what is a homeopathic approach to the GBS. Homeopathy takes an individualized approach to treat the person holistically, aiming to support recovery and boost the immunity. Homeopathic remedies for the GBS are: first one is arsenic herb. It is useful in cases of burning pains, restlessness and anxiety. Then comes the weakness and exhaustion that worsens at the night. Next important medicine is a causticum. It is indicated for progressive paralysis, especially in the upper limb, suitable for patients with muscle weakness and stiffness. Next one is the gelsemium, for cases with marked weakness, fatigue and trembling. It is suitable for patients who feel mentally dull and lethargic. Next one is a plumbum mat, indicated for paralysis with muscle wasting and cramps, effective for cases where the reflexes are diminished. Next one is a caliphos, for nerve exhaustion, mental fatigue and general debility, helps in regaining strength during the recovery phase. Then the rare medicine is a Lathyrus sativus. Its key indications are paralysis of the lower limbs with marked spasticity, stiffness and inability to move the leg properly. No significant sensory loss, often indicated in motor neuron related issues. Now we see the complementary measures in the homeopathy. Most important is a constitutional remedy. A remedy chosen based on the patient's overall constitution can significantly aid in improving immunity and recovery. Next one is a nutritional support, encouraging a diet rich in essential vitamins and minerals, especially B vitamin, which support the nerve health. Next important is a physiotherapy integration, enhancing mobility and muscle strength alongside of the homeopathic treatment. Now we'll see the concluding part. And that brings us the end of our discussion on Guillain Barre syndrome and the homeopathic approach to supporting recovery. While GBS can be a challenging condition, with timely medical intervention and the right complementary care, recovery is possible. Homeopathy offers a personalized, gentle approach to managing symptoms, enhancing immunity, and improving overall well-being. Remember, it is crucial to work closely with your healthcare provider and seek emergency care when needed. If you found this video helpful, don't forget to give it a thumb up, share it with those who might benefit, and subscribe to our channel for more insights on holistic health and homeopathy. Thank you for watching. As always, stay healthy, stay positive, and take care of yourself. Thank you.